Rheumatoid arthritic tendons. I suspect tendons are rather overlooked in RA, I admit myself included. I've always known tendons are affected by RA, but looking deeper into the evidence, I'm surprised at the extent and prevalence of that effect. Some caveats. Almost all the information I have seen is regarding tenosynovitis of the hand. I was able to find some bits and pieces, but nothing I could deem conclusive. As such, I've decided to stick to the hand. I will follow up with a new article if I'm able to find further information, or I've sent some, in the future. Tendon issues associated with RA. Tendons are directly affected by RA. This initiates early, and tenosynovitis has been shown to predict the onset of rheumatoid arthritis as well. As the course of the disease progresses, tendon damage becomes surprisingly, to me anyway, prevalent, and tendon rupture becomes a risk as well. Once clinical remission is achieved, subclinical tenosynovitis can remain and is often used by rheumatologists to ensure optimal management is reached. Deleterious effects can still be experienced if there is ongoing inflammation, even if there is no reported symptoms. Enthesitis is a much less likely occurrence in RA compared to other inflammatory arthropathies such as psoriatic arthritis. As it is primarily a synovitic condition, or the autoimmune issue is targeted at the synovial tissue, whereas the other arthropathies are more enthesitic in nature, or the autoimmune issue is targeted at the enthesis sites. That being said, there is significant overlap in the conditions and also an individualized nature of presentation, so an enthesitis is not out of the question. Tenosynovitis. Tenosynovitis is a condition characterized by inflammation of the tendon sheath, particularly involving the flexor and extensor tendons of the hand, and that's been identified as a prevalent issue among rheumatoid arthritis patients. Utilizing advanced imaging techniques such as ultrasound and magnetic resonance imaging, or MRI, studies have indicated that in approximately 45 to 50% of individuals with RA exhibit signs of tenosynovitis in these tendons. The significance of this observation extends beyond its prevalence, as researchers have proposed a potential link between tenosynovitis and the severity of joint stiffness reported by RA patients. Joint stiffness is a common and often debilitating symptom of RA, contributing significantly to the overall burden of the disease. The hypothesis suggests that the presence and extent of tenosynovitis may play a crucial role in understanding the variability in reported joint stiffness among individuals with RA. In simpler terms, the more pronounced the tenosynovitis in the flexor and extensor tendons, the greater the likelihood of experiencing heightened joint stiffness. It's essential to note that this association does not necessarily hinge on synovitis within the joints themselves, which is a more traditionally recognized aspect of RA. Instead, the emphasis is on the inflammation of the tendon sheaths, implicating them as potential contributors to the overall symptomology of the disease. This insight is particularly valuable in the context of personalised medicine for RA patients. Understanding the impact of tenosynovitis on joint stiffness allows healthcare professionals to tailor treatment approaches more precisely. Targeted interventions addressing tenosynovitis may prove beneficial in managing and alleviating the specific symptoms of joint stiffness, contributing to an improved quality of life for individuals with RA. Tendon ruptures. The high prevalence of tenosynovitis in rheumatoid arthritis carries significant implications for the structural integrity of tendons within the affected hands. Prolonged inflammation of the tendons can lead to detrimental consequences with potential damage or even rupture of the affected tendons. Notably, ultrasound, a valuable diagnostic tool in assessing musculoskeletal conditions, has revealed alarming findings. One study reported that ultrasound detected tendon damage in at least one tendon in a staggering 75% of the recruited individuals with RA. While the specific rate of tendon rupture remains elusive in the provided information, existing literature suggests that such occurrences are more frequent in the extensor tendons. The extensor tendons, responsible for extending the fingers and facilitating hand movements, appear to be particularly vulnerable to the effects of tenosynovitis. This vulnerability underscores the importance of proactive monitoring and the early intervention in RA patients to mitigate the risk of tendon damage or rupture, contributing to a comprehensive understanding of the multifaceted impact of RA on the musculoskeletal system. Advice. Evidence-based advice is sparse here, so please bear in mind the following as a combination of experience and opinion. Remember, these tendons have a pathological cause based in an autoimmune condition. As mentioned, there is a high rate of tendon damage in rheumatoid arthritis patients. Considering this, I would urge therapists to firstly consider that their medical management has been optimized. This will likely involve collaborating with the rheumatologist. In private practice, your access will vary, and discussion and education of the patient to feedback to the consultant is going to be key. Once this process has either begun or concluded, if there are symptoms remaining, then essentially we're looking at treating them like we would any other tenosynovitis. My experience with these tendons is that their reaction to therapies is variable. My occupational therapy colleagues have had some success with splinting to offload the tendon during high load activities. Physiotherapy treatments specifically aimed at the tendon is our favourite loading. Gotta love loading a tendon. My experience with these specific tendons, however, is a dichotomous one. The tendons either react as you might expect them to, or they react really badly. I try to be upfront with patients about this. It isn't a true load-based tendon problem, so the reaction to loading may well not have the same effect. I think there's a lot of mileage in the person management in this scenario. Sleep, general conditioning, stress management, and so forth are really important, as these not only have a significant impact on the tendon health, but also rheumatoid arthritis itself.